Procedure on retained placenta और मैनुअल रिमूवल ऑफ प्लेसेंटा, ये इसका प्रोसीजर है। सबसे पहले हम इसकी डेफिनेशन देखेंगे। इट इज़ सेड टू द रिटेन when the placenta is not expelled out even 30 minutes after the birth of baby. Manual removal of placenta. Manual removal of placenta is a procedure to remove a retained placenta from the uterus after childbirth. Retained placenta क्या होता है? Retained placenta is when the placenta does not completely come out of the uterus after the baby is born. Sometimes a piece of the placenta is left behind in the uterus. It's not common, but it can be serious. It can cause problems day or weeks after the birth. Causes है इसकी, your contractions are not strong enough to expel it. The placenta is unusually strongly attached to the wall of the uterus. You have placenta excreta when the placenta excreta deplete to the wall of the uterus. The cervix closes and traps the placenta inside your uterus. Morbidity, adherent placenta, trapped placenta. Diagnosis की, it is diagnosed by an arbitrary time 15 minutes spent following delivery of the baby. The hourglass contraction is mature of adherent placenta. डेंजर है इसके, रिस्क इन्वॉल्व्स आर, मतलब जो इसके रिस्क फैक्टर्स है, हैमरेज, शॉक, फ्रीक्वेंट अटैम्प्ट्स ऑफ एब्डोमेन, एनिपुलेशन टू एक्सप्रेस the placenta out, puberal sepsis, previous uterine surgery, use of oxytocin, prematurity, implantation of placenta in the lower uterine wall, previous C-section, previous history of retained placenta. Prepare the necessary equipment: antiseptic solution, sterile gloves, blood and solitudes, anesthesia and analgesics, argometrin and oxytocin and antibiotics. Then इसका प्रोसीजर देखेंगे हम। प्रोसीजर में है इसका, सबसे पहले स्टेप 1 है इसका, MRP is done under GA. If not available, under deep sedation, patient placed in lithotomy position, bladder is catheterized. Step 2 है इसका, use antiseptic hand rub or wash and forearms. Put high level disinfect sterile surgical gloves on the hands. Hold the umbilical cord with clamp. Place the fingers of one hand into vagina in the shape come up by draining the fingers and thumb together into uterine cavity, following the direction of cord until the placenta is locked. Step 3 है, when placenta has been locked, let go to the cord. Move that hand on to the abdomen to support fundus. Move the fingers of hand in uterus laterally until edge of placenta is located supporting the fundus, wide detaching placenta. Keeping the fingers tightly together, the edge of the hands gently between placenta and the uterine walls with the palm facing the placenta. Gradually move the hand back and forth in the smooth lateral position until the whole placenta is separated from the uterine wall, withdrawing the hand from uterus. Step 4 है इसका, when placenta is completely separated, palpate the inside the fundus. Palpate the inside of uterus cavity to ensure the all placental tissue has been removed. Slowly withdraw the hand from uterus, bringing the placenta with it. Continue to provide counter traction to the fundus by pushing it in the opposite direction of hands that is being withdrawn. Step 4 है इसका, give oxytocin 20 units in IV fluid, 60 drops per minute. Massage fundus to encourage atomic uterine contractions. If there is continued heavy bleeding, give prostaglandins. 4th है, examine uterine surface of placenta to ensure that it is complete. Examine the woman carefully. Repair any tear to cervix or vagina or repair episiotomy. Step 6th है इसका, examine the placenta for completance. Check for contracted uterus. मैनेजमेंट करेंगे हम retained placenta की, manual removal, remove placenta as whole and inspect from removal. Explain to the patient condition and possible need for theatre. Catheterize, good position and good lightening, analgesic and antibiotics, oxytocin infusion after removal. If the cleavage cannot be left, make the diagnosis of excreta and advise for hysterectomy. If placenta is removed in pieces, manual vacuum aspiration curating have to be done. Medical management: do not give oxytocin infusion and do not MVA रोल ऑफ ऑक्सीटोसिन इन मिनिमल, यूट्राइन मसल रिलैक्सेंट। इसकी कुछ कॉम्प्लिकेशंस हैं, शॉक, पोस्टपार्टम हेमरेजेस, पिपीरियल सेप्सिस, सब इन्वर्जन, हिस्टेरेक्टमी, एम्बोलिज्म, थ्रोम्बोफिलेपाइटिस। बाइब्लोग्राफी है इसकी, दत्ता DC, अ टेक्स्ट बुक ऑफ ऑब्स्टेट्रिक 9th एडिशन, JP, पेज नंबर 392 से 394।